I am the Tofu Golem. Please enjoy the video.
In this video, I will explain how to use an oxygen cylinder in a dental clinic. First, familiarize yourself with the system's components, including the cylinder, regulator, and flow meter. Always begin by checking the oxygen cylinder's pressure gauge to ensure sufficient supply. Remember to maintain good ventilation in your treatment area for safety. These initial steps are crucial for effective and safe oxygen administration. Next, carefully attach the pressure regulator to the oxygen cylinder valve, ensuring a snug fit. Then, connect the oxygen tubing from your delivery device, like a nasal cannula or mask, to the flow meter outlet on the regulator. Double-check all connections to confirm they are tight and secure, preventing any oxygen leaks. This setup ensures a safe and efficient delivery system. Once connected, slowly open the cylinder valve and adjust the flow rate on the flow meter, typically between 2 to 6 liters per minute, based on the patient's needs. Gently place the oxygen mask or nasal cannula comfortably on the patient. Throughout the procedure, continuously monitor the patient's vital signs and comfort level to ensure safe and effective oxygen delivery. After use, first turn off the oxygen flow at the flow meter, then close the main cylinder valve completely. Next, release any residual pressure from the regulator before carefully disconnecting it. Proper shutdown prevents gas waste and ensures equipment longevity. Remember to check the description for a link to the Owala water bottle and other great deals to keep you hydrated. Regular maintenance of your oxygen equipment is vital for patient safety and operational readiness.
Thanks for watching. Consider subscribing if we helped you today.